when it comes to metastatic breast cancer research and emerging treatment options, what are you excited about specifically?
That's a really good question. I think right now I'm very interested in a class of drugs called antibody drug conjugates. What antibody drug conjugates are they take a monoclonal antibody, which is, most patients have heard of Herceptin. So Herceptin is an antibody that goes in and targets HER2. But that antibody is actually linked to a payload of chemotherapy cells. But instead of just, regular chemotherapy, we inject that chemotherapy into the veins. It goes all throughout the body. It can be fairly toxic. Antibody drug conjugates, they specifically find the cells that have that biomarker like HER2 or TROP2 or HER3, and they find that cell and they don't release their chemotherapy until they're taken up by that cell. So it's more a targeted, focused chemotherapy. There is an antibody drug conjugate in HER2-positive breast cancer called Enhertu or Trastuzumab deruxtecan, which is has been shown to have excellent efficacy in very heavily pretreated HER2-positive breast cancer. It's moving into earlier lines of therapy. The drug is so effective in HER2-positive breast cancer, we're also looking at it in something called HER2-low breast cancer. So breast cancers that we never thought before would respond to HER2-targeted therapies. It appears that even if they express a little of HER2, this drug might have efficacy. So that's in clinical trials, and that's really exciting. And what's also great is that about 60% of women with hormone receptor positive breast cancer are HER2 low. So that could be a really great drug option in the future for those patients. There's another antibody drug conjugate called Sacituzumab Govitecan, which is approved in triple negative breast cancer and was shown to improve overall survival, which you always want at the end of the day, a drug that is well tolerated and helps patients live longer. That drug is approved in triple negative breast cancer, but we're now looking at it in hormone receptor positive breast cancer. There are also a variety of other antibody drug conjugates in clinical trials, one that's looking at HER3, a few others that are looking at HER2 and also TROP2. So I'm definitely excited about antibody drug conjugates. I'm also very excited about the field of immunotherapy in general. Immunotherapy has sort of lagged behind in breast cancer compared to some other tumor types like lung cancer and melanoma. But in triple negative breast cancer, we finally have approval for 2 types of immunotherapy, but only if they have a certain biomarker. So only right now, immunotherapy only helps patients with triple negative breast cancer, metastatic triple negative breast cancer, if they express something called PD-L1. So we have FDA approval for 2 different immunotherapies for PD-L1 positive triple negative breast cancer. And there are many different strategies ongoing in clinical trials with different types of immunotherapy that try to harness the patient's immune system to fight the cancer. Instead of just, giving regular chemotherapies, really trying to help the patient's immune response help fight the cancer.